adequate resources for a health service that would comprehensively cater for all the population of this state should be an absolutely key priority for any government. In this state, successive governments have failed dismally to do this in Ireland. Now, during the economic crisis in Irish capitalism in the course of the 1980s, as we know, savage cuts were inflicted in our health services. Thousands of beds, in particular, were cut out of the public hospitals, despite the fact that even at that stage already, health spending here lagged very far behind comparable countries in Europe. And now we have a second major assault on our health services in the wake of the collapse of the property bubble and in the wake of the disastrous decision to bail out bankers and bondholders on the backs of working class people in this country, with the type of austerity that takes billions from the pockets of ordinary people, creating huge problems of unemployment and so forth, and therefore affecting the central taxation income quite dramatically. And in response to their disastrous policy, the government piles disaster upon disaster with a major attack on our health services. We have a government that currently boasts, yes, boasts, of having taken tens of thousands of jobs out of the public services in this state, including many, many thousands from the health service itself. And the effects of that are being shown up quite brutally right around the country, with the huge stress and strain on frontline workers in our health services. Now, the Fine Gael policy on health relating to the funding of the health services into the future and the running of the health services based on what they call universal health insurance is what has dictated government policy in this regard. A full 5 years ago, I made an analysis of that policy of Fine Gael called Fair Care, and it absolutely stands the test of time. Fair Care, according to Fine Gael, would represent the most fundamental reform of the health system since the formation of the state. But what the new policy does do is involve a massive surge in privatisation and in the marketisation of health care. And essentially it hands the running of the health services over to private insurance companies. Listen to what Fine Gael says in their document. I quote, "At the moment, Ireland has two administrative systems for health, one public, the HSE, and one private, the insurance companies. Over time, these two systems will become one, run by the insurance companies." Doesn't that really give the game away? So the document, in fact, is replete with the ideology and the terminology of market capitalism. Thus, for example, health providers will be paid for how many patients they treat. Patients will be a source of income rather than a cost, just as they are in private hospitals today, unquote. And again, a Fine Gael government will encourage insurance companies from other European countries who have experience of implementing social insurance models to enter the Irish market. So our health service becomes a market for competing private insurance companies. Now, the reality is that while claiming that this Fine Gael policy will be based on a not-for-profit ethos, in reality it will involve cutthroat competition for profit in the health system. private insurance companies, which are very much for-profit insurance companies, will control the entire hospital budget. That's the reality. And so public hospitals turned into autonomous units which would have to compete with other hospitals, including private hospitals, for so-called business from these companies. So what we know, that just like the banks and the developers that crashed this economy after their years-long greed fest, we know that private insurance companies are driven to maximise profits for their shareholders. And Fine Gael, and now accepted by the government, would give them inordinate power over patient care in Ireland. So it's obvious that in order to squeeze more profit out of the system, they would put relentless pressure on hospitals and those who provide care to cut costs. So we would have hospitals, doctors, nurses, etc., administrative staff, forced into a vicious competition driven by the commercial imperatives of the insurance companies. And that would inevitably distort what should be the basic criteria for proper health care, which is the health of the patient and the human compassion and well-being of those who are ill. And that's the reality of the situation. Fine Gael says that it relies heavily for this on the Dutch model. But the Dutch model, since Fine Gael's Fair Care document was introduced, has been shown to be extremely prone to crisis and to ongoing difficulties. The Impact Trade Union, which organises thousands of workers in the public health services, says this following a study in regard to the Netherlands. It says, where a system of competing private insurers has created an inequitable and inefficient system of funding, different tiers of entitlement, rising hospital deficits and even bankrupt hospitals. Financial incentives to discharge patients early has also led to one of the highest hospital readmission rates in Europe, because more people experience post-discharge complications, having been turfed out early to save money for the insurance companies so that they can make profit out of those patients. Now, it is an incredible betrayal by the Labour Party that they have swallowed lock, stock and barrel the Fine Gael privatisation programme of the health service, which not only will have the faults that I've outlined, but will also provide for a massive new austerity tax on those people who pay their central taxes, PAYE, VAT and all the rest at the present time, and look to the public health service for their care. They will have an extra tax, some estimate of €1,600 per annum, if this policy was put into effect. Of course, taking again the road of taxing working people instead of the type of tax choices that could have been made in the course of this austerity period. Tax the major corporations, for example, who are taxed among the lowest in Europe, and if we take the estimate of an 8% corporation tax as opposed to the headline rate of 12.5%, based in 2010, every percentage point extra would be €525 million. So a few extra percentage points there, a few percentage points on the wealth tax, another tax on the huge increase in wealth that has been recorded by the very wealthy over the last 5 years. That's the type of income that would provide investment for jobs and therefore more tax resources for the state, but also investment for our health services based on the universal health care for all our people, paid for from general taxation and available to a very high standard. taking, of course, the control of the health services from those current interests that control it, like private insurance companies and others, and putting it democratically into the hands of the frontline health workers, those who really keep our hospitals and health services going, on the basis of a democratic transformation of our health services and the proper funding. Yes, we can deliver a health service that not only is supreme in terms of the care it gets, in terms of no waiting lists, in terms of outcomes for patients, in terms of removal of stress and worry from those who are ill on waiting lists and so on at the present time.
Thank you, Deputy.
But many of the current difficulties would be rooted out and removed as a result of bringing health workers, care workers generally, to the very heart of the administration of the system.